See You Now is a podcast highlighting the innovative and human-centered solutions that nurses are coming up with to solve for today's most challenging healthcare problems. Created in collaboration with Johnson & Johnson and the American Nurses Association, and hosted by nurse economist and health tech specialist, Shauna Butler.
Welcome to See You Now. I'm Shauna Butler. See You Now has always focused on the incredible stories of nurse-led health innovation. And throughout 2022, we'll bring you stories that speak to the current state of the healthcare workforce and the urgent need to design safe, healthy work environments and cultures that attract, value, empower, add diversity to, and advance nurses. And we'll point you to experts, innovators, catalysts, artists, tools, resources, and more to increase well-being, mental fitness, clinical excellence, and joy in the work of improving health and saving lives. We're pleased to introduce a new series, Frontline Forces, documenting the pandemic response of frontline nurses amidst overwhelming challenges and uncertainty that reflect the changing nature of nursing amidst the evolving circumstances they are facing at this point in the pandemic. School nurses are on the front lines of community health. They play a critical role in public health and the health, well-being, and readiness to learn for children around the world. And today, they are guiding schools, families, local officials, and public health departments through a global pandemic unlike anything seen in the past 100 years. Grounded in public health, school nurses have been key in communicable disease surveillance, contact tracing, vaccine education, acceptance administration, and record keeping, in advocating for students and families and policies that enable health and academic success. A strong and robust school nurse workforce is key in preventing future outbreaks by helping families stay current with their children's recommended vaccination schedules. When COVID hit, school nurses across the world figured out how to do all of this remotely, and then how to do all of it again when students and staff return to in-person learning. And let's not forget, this is on top of taking care of students and staff and anyone who visits a school's campus for those usual playground scrapes and fractures, along with the growing need to monitor and manage chronic conditions like diabetes, asthma, and increasingly anxiety, mental health, and bereavement, along with all manner of situations that children magically and mischievously conjure up. With this foundation and their trusted role in the community, school nurses are ideally positioned to lead a coordinated pandemic response in partnership with local health departments. Yet, even before the pandemic, school nurses were overtasked, under-resourced, and hard to find. Despite recommendations from the American Academy of Pediatrics and the National School Nurses Association of having at least one registered nurse in every school, fewer than 40% of the nation's public schools have a full-time nurse. COVID-19 has magnified the contribution of school nurses and the need for every student to have access to school nurses and each school district to have a fully funded, comprehensive health services program. So, with all these demands, what keeps school nurses going? What keeps them advocating for students, families, faculty, and progress? How do they care for themselves while caring for thousands? We checked in with one nurse in Washington State to hear about the role of a school nurse during a pandemic, how she's experiencing this moment, learning from and gaining strength from the support of her national school nursing community, and why school nurses are more important and essential than ever.
Friday of last week, I turned around and these two students had come in with all kinds of scrapes and abrasions and lacerations. And I was like, oh my gosh, what just happened? Well, the freshman boys were out playing King of the Hill on the snowbank. You forget in the world of COVID that you still have teenagers Those teenagers still know how to have fun with their peers, but they haven't got a chance to do that for the last almost 700 days. It's kind of nice as a school nurse to have that change during the day. The boys who decided to play King of the Hill out on the snowbank. I don't know that I could sum up a day in the life of a school nurse because every single day is different. That's why I enjoy school nursing so much, because you can try and plan your day, but it never ends that way. My name is Liz Prey. I am a school nurse in Moses Lake, Washington, and I am the president of the School Nurse Organization of Washington. When I started school nursing, one of the nurses had made a comment to keep a journal that first year of school nursing. I found my journal a few weeks ago. One of the schools that I covered had a dome monkey bar system. There was a student that had fallen from the top of the dome and he had knocked the wind out of himself. And so they had called for me to come out to the playground urgently. As I'm trying to fit through these bars to get in there to make sure that he was okay, all I could think was, okay, think skinny, think skinny, think skinny. So I got in there and he was laughing at me when I got in there, but he was laying on the ground and not moving, and he was totally fine. I thought, oh, you little sneaky turkey. So the two of us crawled out of the dome and he said, think skinny, Nurse Liz. That was a priceless moment. The Moses Lake School District is made up of roughly 8,900 students. We are right in the middle of the state. The community relies heavily on agriculture. We've got a demographic 55 to 65% free and reduced lunch, depending on which part of town that you're in. You know, not very many people know this, but we have a group of students that when they see the school nurse, that might be the only access they have to a medical provider. Before COVID, my primary duty was the nurse for 4 elementary schools. So when I first started school nursing, I had 4 buildings assigned to me, and it was roughly 2,000 kids. Those locations could be 7 miles apart. I had kindergarten classes that I would go in and teach on little dirty dotty done and how to wash your hands and blow your nose, making sure that you were putting your tissues in the trash instead of taking it home to mom and dad. That changed when COVID hit. Our primary focus was making sure that our staff and our students were safe and that education piece was there. I found myself trying to provide support for students and families in a remote setting. I'll never forget one of my families. Dad was home with the kids and mom was stuck in California, and he didn't know how to use his son's emergency seizure medication. So I put a video together with the directions on his son's medication bottle and taught him how to use it and sent him the video and made sure that on the refrigerator they had the basic seizure first aid and everything that they needed, because those were things that mom normally took care of, but mom was stuck in California because of COVID. Currently, I work at the high school. I'm the sole nurse responsible for 9th grade and above in the whole school district. When there's not a school nurse on site, all of our kids suffer. Every student needs access to a registered nurse or a school nurse every day, all day. The role of a school nurse is so different from other types of nursing. When you come into the school setting, you're not working under a provider per se anymore. There's a lot of autonomy as a school nurse, but at the same time, you are working within the constraints of your license and trying to work in the world of education. We're the eyes and the ears for the pediatrician. Who's going to see that case of chickenpox come through? Or who's going to pick up the measles and send that parent to the provider to go get that checked out? It's the school nurse. You find yourself more in a role of being the advocate for the student and the family. When I came into school nursing, another thing that was a big shock for me is in the building that I'm working in now, there's 175 staff members. Every single one of those staff members works underneath my nursing license. It took me a bit to wrap my head around that. I thought, I've got to make sure that these staff members know how to respond and how to handle an emergency and give the right medication to the right student at the right time. And there's just so many pieces that go into that. School nurses in the past have thought of themselves as being on an island. Sometimes we could be the only medical provider in either a school building or a school district, depending on the size. When you find yourself in that situation and you don't have the peer support or a group that you can go and talk to, it's hard to open up and share those struggles. The School Nurse Organization of Washington, or SNO is our acronym, is the professional organization of school nurses in our state, roughly 575 members. Our mission is to support school nurses in the delivery of health services designed to improve the health and academic success of our students. This will be my second year as the president. Never in a million years did I think that I was agreeing to lead this organization during a global pandemic. In that transition to everything remote, one of the big things that we really missed out on is that connection with other school nurses and our national conference. Because we didn't have that, there was a couple of us that decided, you know what? We're Zooming everything else. Why aren't we Zooming this meeting? So once a month, we're able to talk through things. What's happening in Georgia right now? Or what's happening in Texas, where you guys aren't seeing the masks? What can the rest of us expect if things change in our state? We've talked about how hard it is to get members to fill open positions on our boards during the time of COVID, because school nurses, our main focus right now is COVID. It's not in any leadership roles outside of our normal workday because we're already taxed to the max. Burnout is real. Zoom fatigue is real. COVID fatigue is real. Having those connections has been huge. Being in this role has allowed me to make connections that I normally would not have made with our Office of Superintendent of Public Instruction, the Governor's Office, and the Department of Health. That's been rewarding, and leadership from the National Association joins us. This month, the big focus was on legislation and meeting with our senators and priorities as a state. It took a global pandemic for people to realize that our school nurse is on the front line too. My current caseload is right under 2,900 students. School nurses in Washington State in the prototypical model are funded one nurse per 4,650-ish students. And so a district our size would just have under 2 nurses for all 8,900 students. Districts have to figure out a way to fund additional school nurses if that's where their priority is. As school nurses, we have chosen to take this opportunity to make a change. This year, the governor released the budget, and we're so excited because he included school nurse funding in there. And our Office of Student Public Instruction, or OSPI, has included the increase in school nurse funding and wraparound support with school counselors and social workers and psychologists. The focus seems to be right now on getting our students and our little school communities wraparound support to succeed. As a school nurse, if I were to give advice to any of my peers, it would be to just let them know that this isn't normal. And the role of a school nurse is to be there for the community, whether it is a classroom community or a building community or the community that you live in. But you can only be there to the extent that's feasible. And you need to be sure that you're taking care of yourself. If you haven't done that, then how can you take care of your community, whether that be the classroom, the building, or the one that you live in? We will get through this, and we're going to be stronger for it.
Liz Prey is a school nurse for the Moses Lake School District in Washington State and president of the School Nurse Organization of Washington, cleverly known as SNOW. Special thanks to the school nurse and author of the Relentless School Nurse blog, Robin Cogan, for her help with this episode. And keep your ears peeled for more in our Frontline Forces series as we continue to document the experience of nurses on the front lines of help wherever they may be. As Liz said, it took a pandemic to bring awareness to the catastrophic shortage of school nurses, the vital role they play, and that things are changing, albeit slowly, and with an enormous amount of advocacy and struggle. But, she insists, we will get through this and be stronger and better for it. For See You Now, I'm Shauna Butler. Thanks for listening.
Nurses are transforming healthcare through innovation, compassion, and leadership. And Johnson & Johnson is proud to continue its 125-year commitment to champion nurses through recognition, skill building, leadership development, and more. The American Nurses Association is dedicated to building a culture of innovation. Nurses improve the lives of patients and communities through innovative thinking, empathetic connection, scientific rigor, and sheer determination. ANA is proud to support and advocate for our nation's most valuable healthcare resource, our nurses. For more information on See You Now and to listen to any of the earlier episodes in our library, visit seeyounowpodcast.com.